You're listening to Psych with Mike, and the most important way to support the show is to find us on YouTube and hit that subscribe button. So no matter how you listen to Psych with Mike, find us on YouTube, smash the subscribe button, and we really appreciate it. Now, here's Psych with Mike. Welcome into the Psych with Mike library. This is Dr. Michael Mahan.
And I am Brett Newcomb.
So we have a individual who is a follower of the show and had requested us to talk about a subject, and so I'm going to put this out there. So first off, let me ask you a question, okay?
Sure.
Okay. Do you think that you can do therapy for any significant period of time without having a client develop feelings for the therapist?
No.
Yeah, and I don't either. And so that was his question is, what happens when A, that does occur, and B, when you as the therapist become aware of it?
So we all go through rigorous training and supervision to get licensed to practice at whatever level our licensure is. If you're a master's level therapist or a PhD or a psychiatrist. I remember years 30 years ago, going to a workshop that was presented by Dr. Otto Kernberg, who's one of the main, in my lifetime, one of the main sources for the understanding of access to personality disorders. And in that workshop, Kernberg was talking about conversations that he would have with seriously ill patients in mental hospitals about how much they were desiring to capture his penis and make love to him and have love from him. And I was rattled. I mean, I'm like, you don't talk to people like that. You don't say those things to clients. They don't say those things to you. But, I mean, he was a respected source. So we're trained, I was trained, you were trained, to believe that therapy becomes one-directional intimacy. You create an environment where it's an intimate experience for the client, not for the therapist. And that requires that the therapist understand that, understand what it looks like, how to encapsulate it, how to communicate it, encourage it, facilitate it. And that requires that the therapist have really good supervision and really good boundaries.
So can I make a point of clarification?
Certainly.
And then you correct me if you disagree with this?
Always
Okay.
do that, Michael.
So I would say that it isn't a one-way intimate conversation or relationship, because I think intimacy may happen both ways, but it's not sexualized from the therapist's perspective. Because for me,
No,
intimacy.
I disagree. I agree with what you're saying. You have to be very careful not to sexualize the conversation or the experience for either one of you in the room.
Right.
But I still think it's one-directional intimacy.
And so this is why I would clarify the point.
Sure.
So for me, intimacy, I define intimacy as any relationship that has trust, honesty, and empathy in it. And I would think that therapeutic relationship has those three qualities, but intimacy itself does not necessarily have to be sexualized. Like I would argue
Trust, honesty, and what?
Trust, honesty, and empathy.
Empathy. Right.
And so you have to be able to trust the other person, you have to be able to be honest with the other person, and you have to have empathy for the other person.
But I would argue it's still in service of the need of the client.
Yes, absolutely.
Not in service of the need of the therapist. If you're getting your emotional needs met,
right,
for visibility, for
that's
attraction,
right,
for feedback through the relationship with the client, you're out of line and something is wrong.
Right.
So you need better training. You need supervision. And the gentleman that asked us to discuss this in response to a previous conversation we had, my answer to him online was it's really important to have good boundaries and good supervision as the therapist so that you don't lose track of the perspective and the agenda. So again, I would come back to my statement, one-directional intimacy. I want to facilitate, and my definition of intimacy is in an intimate relationship, I take off as many of my masks in front of you as it's possible for me to take off, and let you experience me as I hopefully experience myself, if I'm able to have that level of self-awareness and self-honesty. Then the question becomes, knowing what you know about me, knowing what I've shared with you about who
Do
I
you
am,
still want me?
will you accept me?
Yeah.
And we move forward from there. And then when you do marriage counseling, that becomes a challenge. Can each of you take off enough of your masks to let your partner see who you really are? And then ask them, being who I am, is that still attractive to you, and do you want me? Can we work this out?
Right. So I think but this is a good conversation, because people hearing this, there may be, just like when we talked about ethics, there may be different perspectives about what intimacy is. But I think that the real thing, I think the piece of this that you and I would both agree on is that the relationship can never be in service to the therapist. It must always be in service to the client.
And for instance, talking about sex, when it becomes necessary or important to discuss sexual energy, ideas, desires, behaviors with a client, for the client's energy, desires, behaviors, history, whatever has happened to them, there are two different ways for that to happen. One is for them to be able to say, I did this, I want that, this happened to me, I didn't want that, whatever they need to say, without any present or immediate sexualized energy. You can feel the sexualized energy when someone is coming on to you or responding to you in a sexualized way. And as a therapist, alarms have to go off whenever that starts to happen. For instance, I had a couple that I was seeing some years back, and the woman in the couple, man and woman married, been married for years, and the woman began to think that maybe she wanted to be in a relationship with another woman, and she wanted to explore that. Could she be bisexual? Could she be gay? What would that mean in terms of her marriage to her husband, to her children, so on, whatever she discovered. So she came to me and said, can we talk about this? And I said, yeah, we can talk about anything you want to talk about. And so we started to talk about it. And as she talked about what her fantasies were and her desires were, she started radiating a lot of sexualized energy. And I stopped her and said, well, we need to get your husband in here. The three of us can have this conversation, because he's part of it. And she's, he knows I want to do this. He's okay that I do this and explore that part of my persona, as long as he can be a part of it. And I said, what does that mean to him, and how do you understand that? She said, well, he wants to watch. And I said, okay, if that's what the two of you as consenting adults want to do, but it's a minefield. And we need to talk about where the mines are and what the mines are. And to do that, we all need to have this conversation together. So we did. I don't know that I helped them at all, but I learned a lot from working with them, because I was going to supervision to say, oh my God, how do I handle this so that I don't get
contaminated,
or I don't contaminate with my own agendas or my own judgments. I mean, part of the challenge of being a therapist is, as a person in a room somewhere, you have your own judgment, your own history, your own fears, your own anxieties, your own beliefs. If somebody comes in and says, okay, here's where I am, can you position yourself in such a way that you can facilitate their exploration without your judgment, without guilting, without condemning, but with saying, okay, let's look at the patterns, let's look at the cost-benefit ratios of the choices that you're making, or the hungers and needs that you think you have, and realize human beings have these feelings. You have these feelings. The question becomes, how do you honor them? What do you do with them? What's the cost of doing something with them, or of not doing something with them? And then you make choices. So I think that's what happens when the question comes up about, well, was a client attached to you, or fall in love with you, or likes you, or whatever it is, the words that you use to describe it. Which brings me back to the concept of one-directional intimacy. My job, as I see it, is to facilitate your exploration of who you are and what you feel without shame, condemnation, harsh judgment, punishment, but just say, okay, Mike, what do you think? What do you want?
Mm-hmm.
And then let's discuss it. Let's get out here in the open so you can manipulate it and make choices and decisions about it, instead of a prepackaged propaganda message from me about right or wrong, morality or immorality,
Right.
sin.
So let me ask you this.
Yeah.
So when I'm listening to you talk about this, it sounds like to me that the perception that you are coming from is the therapist recognizes that these things are going on and addresses it.
Yes.
Okay. So I did just
Or sometimes the client will bring it up.
Well,
and
that's what I was
very
gonna-
hesitantly and
Yeah.
reluctantly say, what this man communicated to me was in the online discussion. A client had literally said to him, I'm falling in love with you.
Right, and so that's what I wanted to look at for a few minutes, is that just a very, very cursory online research into this subject returned very, very little about what we're talking about, which is the
Process
therapist.
of handling the discussion.
Right, and a whole lot about clients who identify these feelings and then feel bad or shame, and how they should handle it, because apparently, so I mean, that this is a big issue. I mean, this
that can
happens
happen
a lot.
both ways.
Yeah, sure.
You can come and see me as a client, and I can look at you and I can admire you and start to think, oh my gosh, I want to be more present in his life. I want to be more involved in a relationship with him. That could be sexual or non-sexual. It could be like, I want to go on vacation with you. You like to do things I like to do. You want to go skiing? Hey, I'll go skiing with you when we're not working on therapy.
Well, I'm talking about the client realizes that they have feelings for the therapist. Yeah. And
I'm
then
just saying that can happen both ways.
Can happen both ways. Sure. Absolutely.
But if the client puts that card on the table, or if you ask them to put that card on the table, it seems to me like your reaction to me is somewhat unrealistic. That I'm getting messages or vibrations here that I don't really understand. Can we explore them? That can be an artifact of your grandiosity and your narcissism. I'm so wonderful that this person has to fall in love with me. Or I'm engaged by them so much I want them to respond to me at a different level. So that's coming out of me, and that's why I need either my own therapy or my supervision to help me process those kind of feelings when I become aware that I have
So
them.
let me define a couple of things
All right.
while we're at this juncture. So what we're talking about are the concepts of transference and countertransference. So transference is defined in the article. I'm going to put an article link in the show notes that I found for people who may feel like they have feelings towards their therapist, and some suggestions about how to deal with that and even present it to the therapist in a way that is healthy and really actually helps the therapeutic experience. But transference in this article is defined occurs when a client unconsciously projects their feelings about someone else onto the therapist. These emotions can be positive, negative, or sexualized. So that's transference, the client's experience in therapy of the therapeutic
Projected
experience.
onto you.
Then what we are also talking about is called countertransference, which is the opposite way. So the therapist's perception of what's going on in that therapeutic relationship.
Yeah, I live in a relationship at home. If I have a big fight with my children or my wife, and I go to work feeling bad and angry and upset, and this really attractive client comes in, and they're charming and witty, and I'm fantasizing, gosh, I wish I had that in my life. Then I'm in trouble there. If I can't stop that and park that, and again, that's part of your training. You are trained to park your stuff at the door when you go to work.
And that's an important point. If you are a therapist and you walk into that situation and you feel that way, that doesn't make you bad or wrong, because you're human. You just have to know how to be able to deal with that appropriately.
You have to learn. It's a two-way street. The question that regularly comes up is, how do you sit in a room with people all day, listening to their pain, their rage, their loss, their grief, and then put it down when you leave the office and go home and be available for your kids or your wife or your bridge party or what have you, and not be ruminating about what you heard all day, or not being having emotional flooding or residue from what you dealt with and experienced all day. You are trained to separate that out and put it down, and you have to learn how to do that.
And if you're not, then you need to find supervision so that you can learn
Now,
how.
that's my consistent, regular comment to this whole topic. You need to be in supervision so that, with somebody good that will challenge you. What are you doing with this? You need to be careful. I'm seeing alarms here. Oh, no, you're not seeing that in me. I'd never do that. Well, I need to tell you, I am seeing it. And I think you need to look at your issues,
Right.
whatever they are.
Right.
And then you have to draw the line. Am I seeing you're my supervisor to help me stay professional,
Right.
or you're my therapist to help me unload my own issues?
Right.
You can't be both. You can't be my
both.
supervisor and my therapist. So we have these games that we have to play to try to stay positioned to be available for the client in an ethical way.
So can you, this is a tangent.
Yeah.
Do you believe that you can't be both, or do you believe you can't be both simultaneously?
I believe you can't be both.
Okay. Because I would say that there are times when I have experienced you as my supervisor, and there have been times when I've experienced you as my therapist or even as my friend, and I don't.
Well, it's kind of like Mrs. Doubtfire.
Yeah.
There's a drive-by fruiting.
Yeah.
You may have that flash in that momentary situation of awareness or
But we've never
perception.
had some of those, but we've never had a very specified identification of our relationship being you as my supervisor. Is that the difference? Is that what you're saying?
No, I was your supervisor for some time. I mean, I taught you in school, and
Right.
then I worked with you when you first came into the practice.
Right.
And part of my role in that practice was to supervise other therapists. But I was never your therapist.
Oh, I got you. Okay, I see what you're saying. Okay. So you're saying that if I had that experience, that was my own transference. Yeah. Okay.
Yeah.
I got you.
And I can understand why you'd have it.
I know. Okay, so before we run out of time, though, I do want to address this idea of you're a therapist, you're in practice, and for whatever reason, you become aware that there is this situation, a client has feelings for you. What is the way that the therapist, maybe the client comes in and says, hey, you know
First
what?
of all, you have to be really gentle and really accepting. It's okay that we talk about this. I'm really proud of you for having the courage to put it on the table.
Yeah.
First of all, let me tell you that, other iterations of the same concept. You're my best friend. I'm not your friend. I'm a paid professional providing a service to you. I'm not your friend. We don't go out for drinks. We don't go camping together. We don't bring books back and forth and share that we like to read. You have to have boundaries that prevent you from doing that. And when the client tries to fudge those boundaries because of their need to have a relationship and make themselves different from all
Right.
the other clients that you see, you have to be aware of how to handle that and be delicate. I had a male client that I'd seen for some time who came in 2 or 3 weeks in a row and was really nervous and edgy and needing to talk about something but unable to put it on the table. And finally I said, John, something's going on. You're editing in ways that's non-verbally saying, shouting, but you aren't, what's going on? And he said, I have to tell you, very quietly, teared up, said, I have to tell you, I've been having dreams about you and me having a sexual relationship. And he said, I've never thought I was gay. I don't know if this means that I ought to consider that. I don't know if I am gay, but I'm having those kind of dreams about you. What do you make of that? And he was looking at me to see if I would reject him, if I would throw up on him, if I would say, get out of my office. And he was expecting rejection and hostility. It's not what he got. And it's not what he deserved. I mean,
Right.
what he deserved was for somebody to say, oh my gosh, that's really brave what you've done.
Right.
Let's talk about it.
Right.
Let's talk about what you understand, what you think, what you feel. But understand, these are your feelings and thoughts and perceptions, not something
Right.
that I'm feeling.
And as a therapist, you have to be able to engage in unconditional positive regard regardless of the issue. So you have to be able to engage in that when the client comes and says, hey, I may be in love with you. You have to be able to do that if a client says, hey, I'm thinking about having an abortion. I mean, whatever the issue is the therapist, do you agree?
My
Always has
job
to
is
be
to
able,
help you work through it, not
Right.
to judge you.
Right, exactly.
Or take control of your decision-making
Yeah.
process. To the degree that I'm able to do that, I can work with a broad range of clients. But clients, as much as therapists, self-select.
Mm-hmm.
And I can't tell you how many times I had new clients that would come in and say, I don't know if I'm going to be able to talk to you. I mean, I don't talk to men, or I don't talk to Southern men, or whatever.
Mm-hmm.
And I would often say, you know what, come twice and don't pay me.
Mm-hmm.
And if you come back a third time, then pay me for all 3 sessions. And that would take a lot of their anxiety away. And they would be willing to explore sitting with me for a couple of hours and see if I felt comfortable with them. Because as I tell people regularly, they're saying, well, how do I find a therapist? I say, you have to go and interview them.
Mm-hmm.
I mean, you can't just read a blurb online. You have to go sit in a room with somebody and see how you feel, and see how they respond to you. And if it feels icky, go somewhere else. It doesn't mean there's something wrong with you. It may be something wrong with them.
Mm-hmm.
But you need to find someone that you don't feel that ickiness with in order to do what you need to do in therapy.
And I always, whenever we talk about that, I always have the caveat, understanding that sometimes therapy is difficult, and it has to be. It should be challenging, or it's probably not really very good. So you have to be able to balance those things. If you just feel uncomfortable because it's challenging, that may be different than what you're talking about with it's icky and I feel slimed on.
Yeah.
Okay, can I tell you a story real quick before
Sure.
we end? So I don't know that you remember this, but I do and will always will. I worked in a hospital and was working as a therapist in a locked mental health facility, and at times unlocked, depending on whether I was working in substance abuse or not. But I was working in this substance abuse hospital. And when I left to go into private practice with the group practice that you had invited me into, some of those people said, hey, I want to continue to work with you. And a couple of them actually made appointments and saw me in my new role. And one of them was this young woman, I was much younger at the time as well, who she lived off of a trust fund. I mean, she was a trust fund person, and she was never going to work. She never did work. She went into therapy or into the hospital to detox once in a while when the drugs that she was taking stopped having good effectiveness, which is what a lot of people do. But she came to see me in the private office, and we had one session and it went great. We had a second session, it was going great, and then she says to me, hey, I got a new tattoo, can I show it to you? And I don't even think about it. I'm just like, yeah, sure. And so she stands up, turns around, and starts to drop her pants. And I jump up and start screaming, I'm not going to be your boyfriend. And you were working in the office next to me. And so obviously this was the end of the session, and she made another appointment, which she didn't keep, and I didn't expect her to. And that was the end of that. And we walked out, and you came out of the room next door and said, oh, Mike, interesting session. And that was all you said, and walked away.
Yeah, I thought about saying, Mike, I'm not going to be your boyfriend either. But I didn't think it was appropriate.
And like I said, I don't know if you remember that.
I do not remember
but that was a really, really impactful lesson in my life of how to be able to deal with things. Sometimes stuff's going to happen and that you can't predict. And sometimes it may be off the wall, and you got to learn how to be able to pivot and how to be able to handle those things with aplomb and integrity and compassion. And that's what to me, that is the essence of what being a therapist is really all about.
As long as you have healthy, good boundaries.
Yeah.
Which is a challenge.
It is a challenge. And that's why you need
because
supervision.
we're human too. Mm-hmm. I mean, I have storms at home and in my own personal life. I have fantasies and desires and hungers like every other person in the world. So who am I to put myself in a room and say, hey, come here, let me solve your problems?
Right.
That's why we have to have the training. That's why we have to have the supervision. That's why you have to have a license. There's It's a very complicated situation.
Right. So, and this is very complicated. And so, for people who are listening to this, if you have questions, obviously, please send them to us. If you have suggestions for things that you would like us to talk about, then also send those to us. You can send those through the comments on the YouTubes, or if you want to be more anonymous, you can send those to us through psychwithmike.com. The music that appears in Psych with Mike is written and performed by Mr. Benjamin DeClue. And as always, if it's Friday, it's Psych with Mike and Mike.
Yeah, quit dawdling. Get your ass in good.
So just pick one.